During the pandemic, there was excitement around these frontline workers, right? Community health workers, doulas, promotores, people who are based in the community who had lived experience, who had built connections with the different community members and resources, and they were linking people together. People that needed help with food, housing, transportation, social isolation, finding them resources in the community, get them connected, ensuring they had the emotional and social support, and helping to solve these social determinants of health challenges. So community health workers has been around for decades, but for most times, most of the past 30, 40 years, they haven't been recognized as healthcare providers. So they haven't worked with health plans, they haven't worked with health systems, they've kind of done their own thing, sometimes in a volunteer capacity. There's the promotores, the Spanish-speaking community health workers that were really much volunteer, community-led individuals doing this work through their neighbors, their friends, their family. And so sometimes you'll see groups of them together working in a community. Sometimes they'll be associated with a specific language or ethnic group. Sometimes you'll have community health workers that focus specifically on housing agencies or housing facilities. So they work in specific geographic areas. But yeah, sometimes they're nonprofits based in the community. Other times they're tied to a healthcare system or even a public agency like a Department of Health. And so our company is all about empowering them, supporting them with technology, with a software system that allows them to document all their activities, track the needs of individuals, track how they're getting support, whether it's through organizations or the healthcare system or social services, and then helping them to connect with other resources in the community, maybe to improve their housing or make them more healthy through food and other resources, transportation to get to the doctor's office. Our software system documents all of that and also bills with health plans and allowing these organizations that typically were relying on grants and short-term funding to now get sustainable revenue. When Pear Suite started, we really were focused on impact, and we're to this day an impact-driven company. So we make sure our pricing is very flexible and slides based on their needs. We have some organizations paying us as little as $10 to $15 a month just to use our software because they can't afford much more. What's great about our software is it's really infrastructure for them to get more revenue, whether it's through reimbursement, through the new Medicaid or Medicare policies that allow for community health workers to now get paid, or for them to secure more funding through grants with better data. And these organizations and these workers have been on paper and spreadsheets for many years. For them to transition to now a system for them to document and do claims and maintain compliance with health plans has been really challenging. So we actually built a wraparound support team that helps them understand compliance, understand contracting with health plans, understand how to meet the requirements that the healthcare system has around HIPAA, around data sharing, around maintaining legitimacy and getting that consent that you might need to do claims. And so we realized that we can't just be another tech company. We have to provide that wraparound support. We also do a lot of work around workforce development and training, helping them align with better data policies and structure, helping them get connected to the right key stakeholders in the healthcare system, like policymakers and like health plans that otherwise they wouldn't be able to connect to. So there's a big effort right now to both credential and provide certification for community health workers. Of course, you have a lot of community health workers that have been doing this for many, many years, and that lived experience is their credentials. And so they might not have formal training, they might not have received a certificate of completion or gone through a course. So we're trying to find a balance between what's that lived experience requirement and what's that actual formal training that they should have. During the pandemic, there was a lot of funding that went down to support the training of community health workers. Formal programs started at community colleges or community-based organizations started trainings, but really there's no standardization across the country around what a credentialed community health worker or what a certified community health worker might look like. So we're helping to kind of standardize it a little bit, providing accessible training that's in different languages, in all hours, on the weekends. Of course, making it affordable so they can take their lived experience and upskill it and empower them to do this work. We're also doing a lot of work around billing and compliance. This is something that for the many, many years they haven't had to do. So for them, that's a huge hurdle, right? How do you work with a health plan that has an extensive contracting process, that has requirements around compliance? This is huge, and we educate them on that. We also bring them together. We connect them with other providers. They share best practices. We can build templates around an assessment. What does a social needs assessment look like, and how do they share best practices with their colleagues and friends and neighbors, and then they can actually do cross referrals with each other. So yeah, we love building these networks. We love empowering the network to do more and get paid more, and finally get valued the way they should be.